I want to talk now about the junior doctors' strikes. So, as I said this morning, junior doctors in England will strike on 5 days from the 24th to the 28th of February in this ongoing dispute with the government. This is the 10th strike. The 10th strike. Now, they want a 35% pay increase. That has been rejected by ministers. Now, there has been some movement. So they've been essentially offered 8% plus another 3%, making about 11% roughly. But, as I said to Renee, the BMA, the British Medical Association, didn't even put that deal to its members. As far as I'm aware, they did not put that deal to the members, and so the members couldn't vote on it. Now, as a result, the BMA says the government has failed to meet the deadline to put an improved offer on the table from that, which makes no sense to me whatsoever. And Rob Lawrenson and Vivek Trivedi, who are the Junior Doctors Committee, said, "We have made every effort to work with the government in finding a fair solution to this dispute whilst trying to avoid strike action." Well, let me tell you that there has been absolute catastrophe to the service as a result. More than 1.2 million medical appointments have been cancelled since December 2022 due to these strikes, which are ongoing. We also know that A&E is falling apart. The number of people who waited more than 12 hours in A&E departments has increased by nearly 25% in January compared with the month before. And when you look at what is going on in terms of our cancer care, 100,000 cancer patients are now diagnosed late. 29,000 waited more than 3 months for an MRI or CT. The health service in utter meltdown. And as I was saying, 1.2 million appointments cancelled as a result. And I'm just really keen to understand the view from a junior doctor. Both of us have been there. We've both been junior doctors. We know it's a really tough job. And I do believe that junior doctors should be paid properly. What I'm delighted to say, and thank you very much indeed to him for doing this, Dr. Ed Patrick, who is an NHS junior doctor. He's also a comedian as well, and we've spoken to him before. Good morning, Ed.
Morning. Good to be back. How are you doing?
Well, really good, thank you. And thank you so much for doing this, because it's not easy. And I'm very grateful that you're putting your head above the parapet to talk about this, because many junior doctors, despite asking them, will not come on and talk about this.
Speaking of the parapet, just to point out, I'm not currently so above the parapet that I'm up a mountain doing this. This is just a background, just in case anyone thought junior doctor is just on a ski slope. That's not the case.
Well, oh, right, or normally at a wedding, but let's not go there. Yeah. So where do you stand on this? Because I think the public is tiring of this. The 10th strike, it has gone on a very long time. What's your view?
I think the people who are tiring most are the junior doctors. The junior doctors, we don't want to strike. We want this to be resolved. And she said this is the 10th round of strikes, and nothing seems to have changed much, except the health secretary, who seems to change every period through that. As you mentioned, there's been a pay decrease because of inflation. So it's actually real terms pay cut of 26%. So they're not looking for a pay increase. They're just looking to restore the pay to what it was at 2008 levels. And they've just not come close to that. I think it's curious what has happened recently, because from what I understand is that we've got strike ballot mandate happening again, but the BMA offered to extend for a short period the mandate, or asked the government to just so they could extend the negotiations, and because the government missed the deadline. So I have no idea why they didn't.
Hang on a minute. Yeah, they did. Well, they did. They asked the government to extend the strike mandate, but you can still actually negotiate if you don't have a strike mandate, can't you?
I think the problem is that there's been no trust with the government, and so they can't. It's the only leverage they've had to use. So it's just the same old, and they've had plenty of times, plenty of deadlines, the government, to get to this, and it just doesn't seem to come to any fruition.
So what do you think? Look, in terms of, and this line about pay restoration comes out a great deal. Look, people in this country are struggling. It is a really difficult time. The cost of living crisis we know about. But there has to be a middle ground here, doesn't there? 35% seems way off kilter, and we're now at 11%. What do you think is a reasonable amount that the junior doctors should settle for? And I know that's your personal opinion, and you don't speak for the BMA.
Well, exactly. I don't. And I think that is what they will negotiate, is what they will consider a reasonable offer. And that, I don't know what's been going on around those tables, but it clearly hasn't come to the point where they feel it's suitable enough, and obviously not suitable enough to put it to the members. But as I said, we're tired. we don't want to do this. Junior doctors don't get paid when they strike either, so it's a financial cut to them too. And the health service, even without the strikes, is still in disarray. So it's if we actually funded the doctors and actually helped with recruitment and retention and not let people disappear because the working conditions aren't good and the pay isn't good, then we could actually start to turn that around.
Well, so let me just throw out my idea. So I agree you need to be paid more, but also it's about feeling loved and valued, isn't it? Making sure there's hot food available, making sure that actually there's somewhere to change, for example, on-call rooms, all of that stuff that really has never existed properly. But what about if the government said, right, if you then join the NHS, we'll underwrite your tuition fees over a period of 10 years. So if you then are in the service for 10 years, we wipe out your student debt. Would that help?
I mean, the amount of student debt is massive. So, I mean, I think obviously that would be entertained if it was an offer. It is one of the things that people don't realise. You go through medical school, you've got 5 years of doing that, you've got other exams to take. Even at the start of every year as being a doctor, every year you've got your GMC fees, you've got your you've got your union fees.
So that's the medical council,
yeah. Yeah, so you there's a lot of outgoings along with the student debt. So anything to help with that, because you start off with a massive debt as a doctor.
So in under my plan, I'm basically writing all that off, but you stay at your salary that you're on at the moment, or you get 11%, let's say.
Well, I'm sure I've got to strike deal right now. Got to do the deal now. I think it would definitely be entertained. I mean, it depends, doesn't it, on what the terms would be. Is there a because it's different pathways with it. It's an interesting idea though, because I think one of the biggest problems at the moment is that people go into medicine, especially in the UK, will accumulate a lot of debt.
So just on that 11%, were you? My understanding is that you weren't even consulted and they just flatly turned it down. Were you consulted as junior doctors?
It's not something that I think we were balloted on to ask yes or no whether we take that. So as again, we don't know what the negotiations are around the table. I think the BMA are very clear when they come out and they say, right, this is what we've been offered clearly, and we'll ballot you. But that hasn't happened as yet.
So just looking at the pay scales, so these are effective from April of last year. An FY1 is on about 39,000. It goes up as you become more senior, up to about 73,000. I mean, when I start, I mean, I don't want to go like, when I did it, it was much harder, but I got 17,000 as a house officer back in the day. Dr. Renee, do you want to come in and just ask your thoughts to Ed?
Yeah, morning, Ed. So I started, I think, on 22,000, but it never is 22,000 because say you're working in London, you've got London waiting, you then get your banding depending on how much antisocial hours you're working. Obviously, there's the 40-hour week time directive now, which there wasn't when you were a junior.
No, there wasn't.
I think my issue, Ed, is of course they deserve a pay increase, and I think 11% would be a good one, and I think they should be balloted on that and accept it. But nothing's going to change the really awful conditions which I have written about, which leave people at a point where they don't even want to go to work every day because they're so undervalued. They've got nowhere to eat, they've got no decent food, they've got no rest space, they've got no rest time. Those are not going to change. And I don't think money is actually the issue here. What do you think?
I think it all adds into this whole pot of how junior doctors feel like they're treated. You're right. I don't have a locker to put my stuff in.
I mean, that's ridiculous.
Yeah, you don't have great places to change. It's well documented that. And there are things that we would like to see, but at the end of the day, it's got to be a worthwhile profession for doctors to work in under such a high pressure. And it's, as I go back to, it's been the real terms pay cut since 2008. So it's just trying to get back to those levels that with inflation would see it back to what it should be.
And how much of this is down to the fact we've got far too many managers sitting in the NHS? Don't we need to get rid of all of them and reallocate that money to frontline services?
I think that there's obviously a lot to be said about sort of hierarchies and how things are run, how much could be saved by changing how the system works. There is a lot of bureaucracy and there's a lot of sort of levels to go through and it can be confusing. So I think it's definitely something to be looked at to see if, how can things be run better is something you could always say.
Renee.
Hi, Hi, Ed. I mean, I just want to go back to that comment you just made about 2008, pay restoration. Most of the doctors that qualified in 2008 will now be consultants. It was 15 years ago. Most of them, I agree, not all of them, but almost all of them will be consultants or just about. Most of the doctors on strike today will have qualified knowing what the pay bands were, having no knowledge of the 2008, and actually they're therefore striking for something which has had no material effect on them at all.
I think you could just look at the strike ballot and say the strike ballot has overwhelmingly voted in support of strikes. So unless you've gone and spoken to every single one of those doctors, we don't actually know that. But by the show of their action, they voted for it.
Are you hopeful there will be a resolution finally?
I think there's got to be at some point. There's constant these pinch points, and I think the government can see that the doctors are serious about their negotiations, and we need the government to be serious and not unreliable or flaky as they usually are.
Now, as well as being a junior doctor, you're a very funny comedian, and we've spoken before about that. Now, you're on tour, aren't you?
I will be going on tour, yes, amongst a busy schedule. So I start in Leicester tomorrow. So as you mentioned, I had my book, which came out called Catch Your Breath, and then this is a tour going along with it too. So you can catch me at any one of those cities you can see on your beautiful screen there.
So you'll be in Leicester, then Newcastle, Bath, Brighton, Birmingham, Glasgow, Edinburgh, Cheltenham and London. May the 6th, that's near my birthday. I will try and come and see you in London. I'd love to do that.
Come along, yes, it'd be wonderful to have you.
Well, I would love that. Thank you so much for coming on. Good luck with the tour as well, and I do hope there is a resolution to this as well. Ed, thanks very much indeed for your time. That's Dr. Ed Patrick, who is an NHS doctor and comedian.